This is Susan Morrison, the Manchester Community College Radiography Program Director. Over the next few minutes, I'm going to be presenting an information session on a career as a radiographer, as well as some important information regarding your application to the MCC radiography program. I should first announce that the radiography program is one of two tracks under the radiologic science degree. The second track is radiation therapy. So first, let's define what radiography is. And radiography is the science of using radiation to provide diagnostic images of all the tissues and organs and bones and vessels that make up the human body. It is important to note that radiation is ionizing in nature, and that ionizing radiation may adversely affect both the patient and yourself. Fortunately, since it's been over 100 years since radiation was first used to image the human body, we have several techniques that save dose to both the patient and ourselves that we will discuss in a few moments. So if you're applying to the radiography program, your career name will be a radiographer. And a radiographer is the health professional who produces those high-quality X-ray images. Those images are then provided to a medical doctor known as a radiologist who will diagnose from those images, and in some advanced areas is actually able to treat injuries or disease processes. You will note here that this happy radiographer, one of the ways that we know how much radiation exposure we have received is we wear a device called a dosimeter. And here at Manchester Community College, we use an online system where once a week you can actually get a report of any dose that you have received from the procedures you have been involved in. The good news is, generally, those readings are negligible. So more happy radiographers here, and you'll see it's easier to see the dosimeter on some rather than others, but you'll also notice that they are wearing lead shields. There are some procedures where we do need to stay in the room with the patient, and the good news is by wearing this lead shield for our body and a thyroid shield for our neck, that lead prevents any scatter radiation from getting to our own bodies. So as a radiographer, you should know that this is a high-tech and a high-touch profession. High-tech in that all our equipment now is computerized, and you must know how to move and manipulate that equipment, and high-touch because we interact every day with multiple patients having their X-ray procedures. So you will be responsible for providing for your patients while they are under your care by monitoring them and making sure they are comfortable during the procedure. As I have said, you have to manipulate X-ray equipment, and different rooms and different areas have different types of equipment, much like driving a Ford or a Chevy or a Lexus. You can drive all of that equipment, but sometimes the items that you need to drive are located in a little different place. So you'll have to prepare your room for every exam. That goes along with the equipment as well. Now, as we said, radiation creates those images. Here's where your math comes in. We actually delivered varying amounts of dose depending upon the part of the body we're imaging. The thicker the part of the body, the more radiation we have to use. So there are mathematical calculations that you will have to perform in order to give the right dose of radiation for every procedure you're going to do. So we have to position the patient, and anyone who has had an X-ray knows that generally you have to take two images in a different plane so that the radiologist can see the anatomy essentially in 360 degrees. It's important to know that to image the body from foot to head or head to foot, including your arms, there are over 50, that's 50, over 50 different areas of the body that you have to learn to position. To position, you have to know how to manipulate the patient, what anatomy you're looking for, what the exposure factors are. And there's a process that goes along with that for every part of the body, but it is essential that you know those positioning methods for each part of the body. As I have already shown you and said, we do have to provide protection to patients. We provide protection to patients by over areas that we are not x-raying. We can put flat shields over the patient's body. For female patients, they cannot be imaged while they're pregnant. So we do have to make sure that every female patient in the reproductive age group is not currently pregnant when we take their x-rays. So once we have created an x-ray, we have to evaluate. We have to look at that x-ray before it goes to the radiologist to make sure that the exposure factors are correct, that all the anatomy is on the image. In areas like the chest where the patient has to take in a deep breath, we have to make sure that the correct number of ribs are shown so that we know we have maximum lung volume. There is minimal patient education, and primarily that's related to we do not diagnose from those x-ray images. Again, that is up to the medical doctor known as the radiologist. So we have to let the patient know, for instance, if they're in the emergency department, we're going to take them back to their room, and once the radiologist reads the image, then the emergency room physician will let the patient know what was diagnosed from the x-ray exam. So x-rays were, as I have mentioned, were discovered over 100 years ago, November 8, 1895, by the German physicist known as Wilhelm Röntgen. This is a picture of Röntgen here. And the first x-ray that Röntgen took was a picture of his wife's hand. Now, you can see this was very exciting at the time. This was the first time that we could see inside a living human body. And you can see that the metacarpals are here. You can obviously see the ring on his wife's finger, and these are all the digits in the finger. But the quality of the image is not there as we have now. Here is a current image, and now you can see so much more detail. Now you can see the carpal bones. You can see the radius and the ulna. And this is all anatomy that you will have to know and be able to identify on every image. The other thing is, not only is X-ray high-tech and high-touch, but it is also an art and a science. The science part, you have to be able to identify all the bones of the body. You have to know what specific amount of radiation needs to be delivered to the patient for this exposure. But also, to make this a medical legal document, we have to mark it for the correct side of the body, right or left. And then here's where the art comes in. Your initials as the artist here are always on the image. That's what makes that image a medical legal document. So again, another radiographer, we can image extremities, both the upper and lower extremities, your back from your neck all the way down to the sacrum and coccyx, the skull and facial bones, as well as the abdomen. Here is a radiographer, and as I said, this is the X-ray equipment that we need to manipulate. It will move up and down and across the table. It will rotate at an angle as well, and it will actually turn around so that we could direct the radiation through the patient from the side. So we do have a light on the equipment that allows us to see the imaging field. Obviously, this skull x-ray on the side is not this abdominal image that we're demonstrating above by the radiographer. Here's an image of the vertebral column in the neck and a broken bone in the femur here. Previously on the hand x-ray that we saw, there was a broken bone in the palm of the hand also. So in radiology, as we said, there are 54 different areas of the body you have to image. And the first area that you'll learn how to create an image is for the chest. And as I said before, two projections of the chest. PA, so the radiation is coming from the back to the front of the body, and then left side. Again, you would need to count the ribs, but the black or gray is air in the lungs. Here's air in the trachea here. We can identify the clavicles. You can see the heart. And now you can see the lungs are superimposed, the shadow of the heart, a little better view of the aorta here. And now you see the thoracic vertebrae stacked up, one on top of each other. This white area here indicates that lead shielding that was around the patient's waist that protects their gonadal tissue from radiation exposure. Now, not every patient can travel to the X-ray department. Sometimes we have to do procedures in the operating room, and this is called a C-arm device that you would have to move along with this display device. And the patient in the operating room would be lying on the table here so that we could create an image while the surgeon is performing surgery, oftentimes for broken bones, putting in pins or screws. And sometimes patients are on ventilators or have many IVs and they're not able to travel to the X-ray department. So we can actually take this portable X-ray equipment to the intensive care unit to NICU for premature babies so that we can take images there. So it's important to understand that as a radiographer, you work in all parts of the hospital. You can be in the radiology department, in the emergency department, in the operating room, as well as the intensive care units. Then there's another specialized procedure called fluoroscopy. Generally, an X-ray is not in motion, but during fluoroscopy, we are able to see inside the patient's body. Here, the patient is drinking a substance called barium, and when that comes down the esophagus, it looks black here. And we would do that under control of another individual, again, the radiologist who is a medical doctor who we would assist during this fluoroscopy procedure. When you take an X-ray of that barium after the radiologist leaves the room, the color of the barium is then seen as white rather than black. And certainly if you're going to be drinking barium down your esophagus, it's going to enter your stomach and eventually your small intestine as well. Just an image of you being in the operating room and using various types of equipment. So as a radiographer, that is entrance into the field of radiology. There are many imaging specialties like CT, magnetic resonance imaging, mammography, but in order to do these advanced level certifications, you first have to do the 5-semester program as a radiographer, pass a national certification exam, and then if you choose in the future, you can specialize in one or more of these areas. Much career advancement is available because of these specialties in radiology. I will show you a few pictures. It's common to see CT or computed tomography that allows us to take sectional images of the body. Where you previously saw with the chest X-ray, we saw the whole chest at one time. If there are suspicious areas and the radiologist would like to see a smaller field, now we can see this is a single thickness or a single slice that was created by the computer. Now we're in the brain. The white is the dense bone of the skull. The gray is the gray and white matter of the brain. And the black area now is your cerebrospinal fluid in the ventricles of the brain. So this is an advanced area for imaging, although as a student in the MCC radiography program, you will have some clinical rotations through CT. A similar area to show cross-sectional images, but different physics, is magnetic resonance imaging, where CT uses a specialized X-ray tube, MRI uses a strong magnetic field with radio waves to create the images. And look at how fantastic this is. We can actually now watch the heart beating in this cardiac MRI. And again, another way to image the brain. Other advanced certifications include mammography. You can see the equipment is a little different over here. Also sonography, although sonography is not just to image the fetus, but other organs that contain fluid. So the kidneys, the gallbladder, and your blood vessels can all be examined with sonography. So that's a brief introduction to the field of radiography. Now let's talk a little more specific about the radiography program. In order to learn about different equipment and to image all 54 different parts of the body, we have a series of clinical education sites which every student rotates to. Most of the time you will be assigned to Hartford Hospital, which is a level 1 trauma center. It's a 650-bed hospital. The sickest of the sickest patients are at Hartford Hospital. On the campus of Hartford Hospital, but as a separate building, is the Connecticut Children's Medical Center. So in addition to adults, you'll be learning how to treat pediatric patients as well. The Children's Hospital has a satellite or follow-up facility in Glastonbury so that patients don't have to be in the hospital environment as they're following up on a fractured arm or a leg. A suburban hospital, Midstate Medical Center, is in Meriden, Connecticut. And finally, Jefferson Radiology is an outpatient facility. We have facilities in Hartford and also West Hartford that are under the Jefferson Hospital, Jefferson Radiology umbrella. So again, every student gets to rotate through these various facilities, learning the different equipment and the way procedures are performed. So the radiography program is a 2 academic year, but 5 clinical experiences. You go fall, spring of your first year, during the summer between your first and second year, and the fall and spring of your second year. Don't run out and have these health exams done now, but if you are accepted into the program, you will need to have a physical exam and a series of vaccinations to start clinical. As an expectation of the program, you will need to have a flu shot every year and TB testing as well. In addition to the tuition that you pay to Manchester for the radiography program, there are several additional fees that you pay so that we can monitor your clinical time. This will all be explained to you in orientation if you're accepted into the program, but you will be CPR certified. You will have to have a background check, and we use some online systems called Castle Branch and Trajexis. These fees are for the whole 2 years that you're in the program, and it helps you and the program and your clinical sites monitor your immunizations and physical exam, that it's always up to date. And with Trajexis, you clock in and out, and all your competencies that you do and evaluations are contained on that system. There are both national, the American Society of Radiologic Technologists, and local Connecticut Society of Radiologic Technologists membership fees that you pay yearly as well. And then when you are at Hartford Hospital and Children's, you will park in a parking garage. The fee there is $9 per day. So again, the program at 5 semesters, it only begins every fall. You have academic courses in addition to clinical. So the program does run Monday through Friday for a total of 32 to 36 hours in the program. You cannot have a full-time job and be enrolled in the program, nor can you do the program on a part-time basis. But many students do work 15 hours or so, either in the evenings or on the weekends while they're in the program. Generally speaking, we follow the Manchester Community College academic calendar, with the exception of the spring semesters. We start clinical, not academic courses, the first day after January 1st, so that you get some additional clinical time while you're not also taking academic classes. Finally, in your last year in the program, we do have some 1 to 9 shifts at both Hartford Hospital, Connecticut Children's, and Mid-State Medical Center, so that you can see an alternate shift besides the 7:30 a.m. to 4 p.m. clinical rotations. So in addition to the prerequisite courses that I will mention in a few moments, I do encourage students to complete their Psych 111, General Psychology, and an arts elective before entering the program, because that just frees up your time while you're in the program. And if you are interested and you have time in your curriculum to take some additional courses, medical terminology, chemistry, or a general physics course is helpful. So where are you going to work? Primarily, you're going to work in a hospital, an emergency center, a physician's office, a walk-in center, in a health-related facility. In the future, in addition to those advanced level certifications, you may want to get into equipment sales and marketing, which would require a bachelor's degree. And if down the road you're going to be an educator in radiography, you would need a master's degree. The starting salary for radiographers in Connecticut is $50,000. That's without the advanced level certifications. So to apply, you're attending this virtual information session. Please note the date down on your application. If you're not currently an MCC student, you need to apply directly to MCC. If you are currently an MCC student, that step number 2 has already been done. You do need to submit your health professions radiography application, which will be only submitted online this year. Have all official high school and college transcripts forwarded to MCC. If you're a new student, if you're currently an MCC student, this has been done. So the prerequisite courses for the program are English composition, college algebra, public speaking, A&P 1 and 2. Cumulative GPA, not for these courses, but cumulative GPA must be 2.5 to apply to the program, and your math and science courses must have been taken within the last 5 years. So for the fall 2021, the application deadline is March 15th, 2021. We are not currently able to arrange for the observation in the radiology department due to COVID considerations. Should that change, I would certainly interact with you separately. But everyone will have a personal interview, either in person sometime in April or potentially online as well. As you graduate from the MCC radiography program, that's your first goal. But the second goal is to take a national certification exam by the American Registry of Radiologic Technologists. That exam will allow you to perform as a radiographer in all of the 50 states. So where you may be learning how to take x-rays in Connecticut, you could work in Hawaii, Alaska, Maine, wherever you would like to go. On our first attempt, 89% of the applicants have passed their certification exam, and most people have passed on successive attempts. You have 3 attempts to take that exam. One person took the exam, did not pass, and chose never to take the exam again. The other good news, though, is that our employment for all of these graduates looking for employment, they all find jobs 100%. And our program retention for the number of students coming in, the number that graduates is 96%. So this has been the introduction to the MCC radiography program. Thank you and have a great day.